Let's go. Hello, my name is Dr. MarkAlain Dery, and I am the Medical Director of Infectious Diseases and the Chief Innovation Officer here in Louisiana for Access Health Louisiana. You've seen me do these updates now for the past few months, and in conjunction with the leadership of the ACOI, and I hope that these messages are helping you keep up with the latest on COVID-19. I know that many of you are in the thick of the fight, and I would like to thank you on behalf of all of us who focus on infectious diseases daily for a living. And I'd like to also thank you on behalf of the ACOI as well. I live in New Orleans, Louisiana, and I serve as the co-chair for the ACOI Infectious Diseases Subspecialty Section. And we are facing this once-in-a-lifetime, hopefully once-in-a-lifetime, global battle. So I'd like to hear from you, my colleagues who are experiencing the fight from their own locations. No matter who you are in the country, I provide my contact information at the end of each update, so please listen for that. I hope you take me up on this invitation to reach out. Moving forward, together with the ACOI, we will continue to share information as it becomes available, as well as some of the hopeful progress that we are seeing. So let's educate ourselves, let's get schooled about a very important topic, and that is schools and COVID-19, especially as the fall approaches. All right, so let's get schooled. Comparing the U.S. to other countries and how other countries have managed COVID-19 crisis, you will come to a very important conclusion. And one of those conclusions is that our numbers are way out of control. While the European Union has seen marked decreases in cases, the U.S. cases are skyrocketing. Please go to the chart that is in the sources of the ACOI COVID page. It's a disturbing depiction of the trend. Namely, it's this and it's that, right? Okay, secondly, there's no nation that has tried to send children back to school with the virus raging at levels like we have here in the US. So do we want to lead such a grand experiment? The scientific research about transmission in classrooms is really insufficient. But what we do know is that crowded indoor spaces with poor ventilation are a perfect place for the virus to transmit and infect people. And unfortunately, many of America's schools fall into that category. And also, let me just say as an aside, this is probably why other countries are doing better, because their schools, I'm assuming, are likely not as in a condition that our schools are in. Okay, so how do we send kids back? Or the better question is, should we send kids back? And the answer may be found in looking at how some states are handling that question. Take New York, for example, Governor Cuomo, who has successfully been bringing the case rate down, way down. And in his state, he's looking at school reopenings in what I think is a very smart way. He's allowing schools in New York to open only if the infection rate in the state is below 5%. So that's smart, right? He's not trying to do whatever phase openings, phase states, whatever. He's not doing that. Instead, he's using solid numbers based on science to make this very important decision. So let's look at Pennsylvania, which is a neighboring state to New York. And they're restarting schools on the other hand. But while they are definitely resuming the school year in September, they are requiring masks. They're not requiring masks, and they are not requiring those who refuse to comply with any proof as to why their children cannot wear them. So this puts people like teachers, custodial staff, librarians, school nurses, the kitchen staff, folks who may be at risk, in real danger, since they can just simply refuse to wear them. Like, what? Like, yo, mask up, COVID down, okay? So we know that children are at a much lower risk of getting seriously ill from the coronavirus than adults, but that risk is not zero, okay? And some have died, and others have needed intensive care because they've suffered from respiratory failure or, of course, this multi-system inflammatory syndrome that we've been seeing as well. And we've talked about this before on this video blog. And this, of course, causes heart and circulatory problems. But my concern with reopening schools is the potential for children to become infected, and many will not likely have symptoms, but they will transmit virus to others, including vulnerable family members, grandparents, and like I said, teachers, school nurse, and other school staff. Dr. Anthony Fauci, we'll be hearing more about him in a moment. Dr. Anthony Fauci, making infectious disease doctors cool again. Dr. Anthony Fauci recently said, in all his years, which is around 40, but who's counting, he has never seen one pathogen have a range of 20 to 40% of people who are completely asymptomatic. And this quality of the virus in opening schools, regardless of case levels, is really a recipe for disaster. Guidelines for schools to open ought to be based on science, rate of infection in that state, just like New York State is doing. For example, opening schools in Florida, where their case rates right now would be a complete disaster. Here in Louisiana, we are requiring masks, and schools that are staffed with my clinic, where I work with Access Health Louisiana, will definitively be making sure that all masks are to be worn, especially within the clinic, and if not, we will be pulling folks from those clinics. Listen, in summary, folks, I understand it's difficult. I know it's hard, and there's so much here to think about, but we haven't gotten the public health system down yet. We haven't. And the idea of then just letting this virus, you guys are on the front lines, you're in the trenches, you see it like I do, and we're just letting this virus just literally roar through the community. The levels that we have right now are higher than we did in March and April when we pulled kids out of schools. And with higher levels now, we're going to be putting kids back into schools. I'm not happy about this, and we will continue to report about this on this ACOI video blog. For the next story, this one is really the importance of listening to science. So there are times that I look at those who make claims that COVID-19 is not real, and I wonder, why did I go to medical school? After all, we could just ask a game show host for his opinion to determine if it's real or not. And a former game show host for the TV show The Love Connection, as well as others like Scrabble, which was a show that I actually was on when I was a teenager for Teen Week, is getting a lot of attention for his tweets that he said that the virus is a hoax. I just will pause for a second and say that the person that I was on Scrabble with when I must have been 16, she was very funny because she always would be like, "Yes, Chuck. No, Chuck. Chuck, how are you doing?" She was very funny and she was very sassy, and it still makes me laugh all these years later. Anyway, so he thought he's getting a lot of attention for his tweets, and I lost, by the way. But I was this close to winning. I totally spaced out. Anyway, I couldn't spell calendar. Whole different story. Anyway, he's getting lots of attentions for his tweets that the virus is essentially a hoax. I still can't spell calendar. I still get, is the last vowel is an E or an A? I still get confused. Anyway, so okay, seriously, this is actually a serious story. Anyway, so he sent tweets out that the virus is a hoax. This is serious. But tell that to the family of a 30-year-old who died after attending a COVID party in Texas a few weeks prior. Thinking that the virus was a joke, he attended a gathering with an infected person to test whether or not coronavirus was real. Anyway, he died this week, and some of his last words were, and I quote him, which is, "I think I made a mistake. I thought this was a hoax, but it's not." So listen, there's real danger in demonizing science. And again, physician leaders like Dr. Fauci, who are being denigrated for not knowing all there is to know about the virus and for keeping the public up to date with the best information that was available at the time, even though it may evolve over time. He also is being marginalized because he speaks honestly and doesn't mince his words, and often speaks the truth that many don't want to hear about wearing face masks, and taking tough stands on how to handle the pandemic. He also pushes back on false claims. And last month, Dr. Fauci said many states had to reopen too quickly and people were not abiding by rules of social distancing. Listen, science evolves, pandemics evolve, viruses, of course, evolve. We need leaders like Dr. Fauci front and center to continue telling the nation what he knows and providing his best thinking. And I think all of us who study infectious diseases appreciate him and his honesty. He's been the director of the National Institutes of Allergy and Infectious Diseases for 3 decades, and he's also one of the leading experts of pandemics in the U.S. For the last 4 decades, and I completely respect that. And Dr. Fauci, if you're watching this, and I hope you are, if you need an assistant, I'm not saying anything, I'm just saying, just saying. Anyway, all right, so thank you guys so much for watching. Please stay on the lookout for our regular updates, and to read more from our sources that were used in this report, please go to the acoi.org acoi.org/COVID-19. Together with the ACOI, we will help you have the latest information to help you respond to your patients and stay on top of this crisis. Also, again, please feel free to reach out to me at madery@mac.com. Please stay safe. We can do this together.